Dr. Andre Posner, A Life of Medicine, Mentorship, and Mindfulness. Dr. Andre Posner never planned on becoming a doctor just to write prescriptions or make quick diagnoses. For him, medicine was always about more than science. It was about people, patterns, and purpose. I was born into the idea of service. He says, my father helped eradicate smallpox in Africa. That example stayed with me. Born in Dakar, Senegal, Dr. Posner is the son of 2 Peace Corps volunteers. He grew up in Marion Station, Pennsylvania, in a busy household with his parents, grandparents, and 6 siblings. That environment taught him patience, listening, and how to work with all kinds of personalities. Dr. Posner graduated from Lower Merion High School in 1985. From there, he studied pharmacy at the Philadelphia College of Pharmacy and Science. He earned his Bachelor of Science degree in 1990. He later attended Nova Southeastern University College of Osteopathic Medicine in Fort Lauderdale, Florida, graduating with honors in 1997. During medical school, he completed a clinical rotation in tropical medicine in Costa Rica. I wanted to learn in places where resources were limited, he says. It pushes you to think differently. After medical school, Dr. Posner completed his family medicine residency at Frankfurt Hospital Bucks County campus. He finished in 2000. His first years as a physician included work at private practices and hospital settings across Pennsylvania and Florida. Between 2000 and 2006, he worked as a family physician at the Center for Preventive Medicine in Bala-Cynwyd, Pennsylvania, while also holding hospitalist and primary care roles with Mainline Medical Group and South Philly Diet, Inc. I liked balancing outpatient and inpatient care. It gave me a better sense of the whole patient journey. He explains. Over time, Dr. Posner focused more on hospitalist work. He took on roles at Naples Community Hospital in Florida, then returned to the Philadelphia area in 2008 to work at Frankfurt Hospital and later at Bryn Mawr Hospital. At Bryn Mawr, he also began teaching medical residents. It quickly became a passion. Teaching forces you to think clearly. You can't explain something you don't really understand, he says. Between 2009 and 2014, he was a teaching attending in the family practice inpatient service. He led core curriculum design, taught rapid response medicine, and supervised residents in real-time clinical situations. Dr. Posner's dedication to education has earned him multiple awards. These include the D. Stratton Woodruff Award for Excellence in Teaching in both 2010 and 2014. In 2022, he received the Faculty Award for Resident Teaching at Lower Bucks Hospital. But for him, awards are secondary. What matters is when a resident tells me, years later, that something I taught stuck with them. That's the reward, he says. He's currently a teaching attending and hospitalist at Penn Medicine in Philadelphia. In 2016, Dr. Posner worked as a consultant for Polis Ventures, advising healthcare tech startups. He helped them evaluate products from a clinical perspective. It gave me a new lens, he says. Healthcare isn't just changing in the clinic, it's changing behind the scenes too. He returned to more hands-on roles in 2017 as medical director at Greater Philadelphia Weight Loss and Family Medicine, a position he still holds. His current work combines inpatient care, teaching, and outpatient services focused on weight management. Outside of medicine, Dr. Posner is an avid chess player. He sees strong parallels between the game and his career. Chess teaches pattern recognition, patience, and thinking. A few moves ahead. That's exactly what you need in medicine. He says he uses chess as both a teaching tool and a personal reset. In the hospital, things move fast. But if you slow down and look at the whole board, the whole patient, you make better decisions. He explains. Dr. Posner also practices meditation and spends time in nature. I need stillness to think. He says, it helps me be fully present with patients, especially when the situation is stressful. He encourages residents to find their own grounding habits. Burnout is real, but if you know what keeps you centered, you'll last longer and do better work. He adds, today, Dr. Posner is a board-certified physician with more than 2 decades of experience. He has worked in many of Philadelphia's major hospitals, trained dozens of residents, and helped shape local inpatient medicine programs. He is a member of the American Osteopathic Association, the American Academy of Family Physicians, and other medical groups. Reflecting on his career, he says, I've made mistakes, learned from patients, and seen medicine change. But I've always stayed curious.